Welcome to the Meat and Potatoes podcast. We are into one of the best months of the year, which is September, and the leaves are changing, and you can feel a little bit of fall in the air. We're joined by Stephen Fabiano, who's the CEO and founder of Fia Care, and Josh Goodrich, who's the Senior Vice President of Sales at Fia Care. How are you guys?
Terrific. Thanks for having us, Garrett.
Good. Thank you.
You bet. We have a nice map of the world with an airplane and then a closet, looks like.
Hey, you know what? There's a lot of great things in that closet.
I bet. All right. Let's start with you, Stephen. Kind of lay the foundation of what Fia Care is. Where did the idea come from, and kind of your journey up to this point?
Well, I've been working on what has ultimately become Fia Care for the past 5 years. I've been working in healthcare for 10, 12 years. It depends on what you count as working. I started out 15 years old in the mailroom of a healthcare technology company in Miami, where no one spoke English. And so you learn Spanish pretty quick down there. But I've been bouncing around in the Medicare world for several years with our customers primarily as health plans. And so you get a really good look into what are the pain points for patients, what are the pain points for health systems, what are the pain points for health plans. And the deeper you get into the healthcare world, the more you realize the terrific morass that it is, and that a lot of people's attempts at making sense of it or fixing them are, it's you're putting Band-Aids on a rickety boat in the middle of the ocean. And so 5 years ago, started down the road of, well, how do you reduce costs essentially for patients? And so toyed with medical tourism, and that's actually when I got Josh involved. He came over and stayed at my house, and I ran him through the concept, and he called a whole bunch of Mexican doctors to see doctors and or dentists. I don't remember exactly which, and to see what the opportunity was. And that evolved into building several products that didn't materialize into company. Beta test the product. You're like, wow, what a great product. Not a great company. And we settled this year on what we're doing now, which is direct primary care at a subscription, no insurance, delivered to people's homes, really as the result of kicking around every place we could, looking for a place to deliver cost savings that wouldn't sink the ship.
Yeah. Okay. So a lot's gone into it, and anytime you've lived in the Medicare world, that's not a good time to live in any world, right?
Yeah.
I don't even know what the heck it is, right? Who pays for what, how, when, and why? Insurance is a gnarly beast, and anytime there's innovation like this, I think it's very cool. So the calls down to Mexico for, what did you call that? Tourism, medicine?
Medical tourism. Yeah, that's the dodgy act of going elsewhere for cheaper medical care.
I thought that's what it was. So if you want like horse tranquilizers to fix
yes.
Yeah, okay.
If you want chemo, the chemo substance that's made primarily of Diet Coke, then that's where you go.
Gotcha. So like on Seinfeld, when Kramer had the same cough as a dog, he went to the vet.
Yeah.
Gotcha. Very cool. All right. So you've been at it a long time as far as like ideas and products, and landed on that certain products aren't actual companies. So you've landed on a nice little business model, it looks like, going over your website. And it seems very straightforward and very cool in my opinion. You read these books about these old tycoons like Vanderbilt or JP Morgan. They always, anytime they're going somewhere, they have a surgeon and a doctor, right? Because they're rich enough to do that.
Yep.
And they probably, the rich, I don't know if the rich dudes today do that, but back then it was probably pertinent because you never know what would happen. And I've always, if you've got kids in the middle of the night, you're like, Boy, it would be nice to have a doctor in the family, or, a next door neighbor instead of going through the whole thing. But yeah, sorry, tangent there. So the business model is people, medical professionals will come to the
Yeah.
patient and walk us through that. And how did you guys land on that?
Well, it really came about for me last year when my now 3-year-old had an ear infection in the middle of the night, and so we waited to take him to the urgent care. We didn't know it was an ear infection. We just saw that he was upset and feverish. So we take him to the urgent care. They say, "Yeah, he has an ear infection. Here's some penicillin. Go home." We give him the penicillin. Wake up the next day and find that he's covered in hives. Turns out he's allergic to penicillin. So we go back and they prescribe something else, something that's not penicillin that got rid of the infection. And then he was all good. $800 later, I'm looking at that bill and thinking, well, there's a few problems with this. One, what is it? Like 99% of the population can't afford, it's some insane percentage of the population can't afford a $500 medical expense that would come out of the blue. Secondarily, I had to drag screaming kids into a car and then drive them to the urgent care and then, ruin everybody else's day with that whole entire, circus. Yeah. And so that led to, that led to the question of, do the economics work for providing care that is affordable, which is where the subscription comes in, and is accessible in a way that's convenient, like when the hours make sense, et cetera.
Yeah. Okay. And then, so Josh, walk us through some of the basics of the business model as it relates to you selling it to clients, and who are your customer list? Who would that be? And what are the advantages for them with your business model?
Awesome. Great question. So we've got a couple different target market segments that we go after. So we're selling to employers who are going to provide it as a benefit for their employees. Because of the competitive landscape that we're in, not only here in the Silicon Slopes area, but Utah in general, and across the nation, employers are looking for added benefits to be able to give to their employees, right? To keep their environment, their workplace more competitive and more attractive. The other thing that we looked at was when COVID hit as well, we were like, okay, well, what's going to happen post-COVID? How many people are going to be going back to the workplace versus how many people are going to be staying home? And how many people even post-COVID are going to be more, I guess, conscious of germs, right? Not wanting to take, I've got 2 young boys, and whenever, one of them is sick, we've got to take both of them, right? Because normally I'm working or my wife's working and we can't get the schedules matched up or find a sitter last minute. So we've got to take the healthy kid to the doctor, expose him to the sickness. So the unique value proposition for the employers is an added benefit to keep talent and then also retain talent as well. Provide something that's more convenient, more readily accessible, and it's actually going to get used as well. Because one thing we're finding out and talking to employers is they're like, yeah, we provide the benefits, but we have no idea what our utilization rate is. We have no idea if our people are actually using the healthcare or not. And so this way, we're able to track that for them and give them quarterly reports on the utilization rate and essentially the health status of their employees, right? And most people work, typically till about 5, even 8 o'clock at night. And it's hard to, when you got dance practice right after work, or you got to get somebody to the football game, you've got all these extracurriculars. Who's got time to, schedule a physical? And when you do schedule a physical, the average physician can't see somebody for about 24 business days. So being able to provide that in home, or if people are back at the office, being able to send our practitioner to somebody's office and get everything done, physicals, labs, all of that. So that's the unique value proposition. And then combining that with their regular insurance, over time, what's going to happen is they're going to see a reduction in claim amounts, which when you see a reduction in claims, just like driving a vehicle, your premiums are going to start coming down. So it's going to not only keep employees healthier, happier, make them love their company more, but also save them the out-of-pocket expense as well, because an average person out of pocket just on general primary care will spend about $572 a year. And we essentially eliminate that cost. So that cost goes to zero. And then the employer gets to reap the benefit of satisfied employees and then also savings as well.
Yeah. Yeah, I can see a lot of value there, obviously for the user as well as the poor guy or gal running HR and trying to make these decisions.
Exactly.
Yeah. Okay. So real quick, whoever wants to field this one, Josh, you briefly hit on a few things, but what could a customer expect as far as services from Fia Care, not FIA, right?
You know what? At the end of the day, it's all the same.
Go for it, Stephen.
So the what's available to our patients is chat with our providers, so they can chat anytime with our providers. They can schedule telehealth visits throughout the day, and in-person visits we're launching right now with after hours and weekends, because the customer demand really has been for when I'm home from work and when I'm when they're Saturday, Sunday, they've got free time.
Yeah.
So that's all included in the subscription, and we're charging $50 per member per month right now for our customers. And in that, aside from those services, you also get all of your labs and blood work. So infectious disease testing, lipid panels, anything that you'd really be getting from your provider. That's what you'd be getting here. And you get, as scheduling permits, you get the visits that you're able to schedule in that time. And so, the part of this thing that solves is, I always got somebody at my house aching, moaning about something, and usually it's me. And so I want to know I want to be able to consult with someone, and I don't want to have to wait, 2 weeks to see my primary care and then be told that yeah, you're fine, or no, this is a serious knee injury. We probably want to start physical therapy.
Yeah.
So anyways.
Okay. Oh, go ahead. Sorry.
Oh, sorry. I wanted to, if I was okay to jump in. The other thing is, as well, is how many of us have jumped on WebMD to self-diagnose, right? We, oh man, I've got a lump here in my neck. We look it up and we're like, oh, I've got cancer. I'm dying tomorrow, right? Yeah. And then we're completely wrong. Typically, I should say. So this allows, as Stephen was mentioning, better and more accessible access to an actual provider, where instead of having to look it up in WebMD, shoot a message, shoot a picture over to the practitioner and actually get some real help. That way you don't spend your whole day worrying yourself over hopefully nothing.
Yeah. We've all got friends that everything is on the table as far as diseases and ailments and calamities. So, you wake up and something's off, you might ping somebody on your network, but are there any controls that you guys have for those that think they have every calamity known to man? Or
overutilizers? Yeah, we haven't landed on a precise rule yet. We want to see how utilization comes in for the first few months before we say, hey, we probably ought to cap visits to this amount per month. And it may be, the way Costco does it, where they let people get away with a lot for a while, but once you've stepped past the line, it's an individual case by case basis. So we'll see how that evolves.
Yeah, it's interesting because for somebody fairly dumb like me that is always doing stuff that could end badly, either on the farm or, I'm going to go deer hunting this weekend, and the way I hunt will depend on the danger level, because as you get older, you have to be a little bit more careful and all of that. So there have been a lot of times where I haven't done something because I didn't want to go to the hospital or the doctor, not so much for the pain, but for like the paperwork or just the confusion. Like if I knew I was going to potentially dislocate a finger and I knew I could call and show, the doctor or nurse my finger, I would probably go ahead with the planned activity. But I don't think that's the use case for you guys, but it is nice to know that if something goes a little bit wrong, you don't have to wave a red flag and completely upend your day and all of that.
Well, that's the interesting thing, is because, not to get in too much to the roadmap, but we do see a future for additional services, and we're kind of in the process of designing that, not just from an operational perspective, but from an economic perspective as well. But that, what you dialed into right there, is really the central problem with primary care and a lot of medical care, which is, I don't want to go do this activity because I might get hurt, and the cost is unknown to me. And so, and that's because I don't know if you're familiar with this, all healthcare jargon now sounds like regular English to me. And so I always ask people to call it out if something gets too much into the arcana of the business. But fee-for-service medicine, which is Garrett comes in, Garrett's got a messed up finger, we're going to x-ray. Well, the x-ray has a charge. Me thinking about Garrett's finger has a charge. Me looking at Garrett's finger has a charge. There's a little code, and for every little thing that I do for Garrett. And so the incentives are in place such that, for every single provider in the country, I'm going to do as many things as I can so I can maximize revenue. And so you see patient visits go down. You try and get patient volumes go up, and that's what we're trying to alleviate.
Yeah, absolutely. Really cool. All right, so I think the model will resonate with people, and it's fairly easy to understand from both the cost savings and time for both the company and the individual. So could an individual just buy this service from you guys, or do they have to be employed by a company that buys it for them?
We've got a guy in the alley, Josh's friend, that they can come. It's just around State Street downtown. And if you slip him $65, then he'll let you in.
Okay.
I'm just kidding. Yeah, they can subscribe.
Okay, cool. All right. So question for you, Josh. How have you kind of built your sales process and your team, or how do you plan to build your team to do this type of sales?
Great question. So in anything kind of like we talked about earlier, anything new, anything that you're doing new has its challenges and difficulties, right? And I'd be lying if I said that we didn't have any challenges or difficulties on the sales end. It's a process, and it's an ongoing learning process how to be most efficient. So the way that we're building it out is hiring account managers, SDRs, and using third-party software to be able to gain direct access to the emails, and then also the phone numbers of those who we seek, C-level executives and HR benefit directors for the companies. We've also got a side on the direct to consumer side that we're going to be implementing right now. We figured that the best strategy and best approach, instead of trying to run around and hit everything, is to focus on one side and then worry about the other side later on. That way we can put full focus on. So through cold contacting, through networking, hopefully we'll have more events that we're able to go to this year. A couple weeks ago, we went to the Venture Fuel Summit up there in Draper, and that was really great for us. We met a lot of good people. We were able to make some good connections and partnerships. So that between developing the sales program, using those third-party softwares, cold calling, kind of the world that I've come from, and then all the traditional marketing that we're going to be using as well. Through Blip, we should have a billboard up here pretty soon with one of our partner companies.
Cool, awesome. And then Stephen, how have you overall grown your team, and what are your plans for the next 6 to 12 months as far as growing your team, fundraising, bootstrapping? What's your roadmap look like there?
So we've been bootstrapping from the get-go. I've been socking away those nickels for the past several years to give us some fuel for this, and we're in the process of getting some lending figured out, and then also beginning that first round of funding to see us through 2021. As far as the team building, I mean, you know, that kind of gets into there are positive things to that, and then there are tough things to that, and I think that's probably where I've learned the most. I think that you know, I've been parts of different startups over the past few years in various capacities, and I think there's that. Oh, you can read about it. You guys probably have blogs about this. But you get people together. Everyone thinks everything's going to be a certain way. People are staking out claims, and then 6 months later, nothing's the same as where you were. And I think there's a certain naivete that I certainly had bringing on different people where you think things are going to work out, and then they just don't. And so
yeah.
I don't know how much you want to get into that as well.
No. Yeah, I mean, it's probably one of the banes of CEO's existence, starting out of, you know, you might know them, or you think, all right, I got a good read on this person, and then they turn out to either view everything completely different than you, or they never got on the same page, and it's a bummer, but definitely a part of life, obviously.
Yeah. And so
it does slow you down.
Yeah, I mean, it can slow you down but if it doesn't work, if there's something that's just functionally not working, then you know, it can speed things up as well, because whatever friction there was, it gets removed.
That's a good point. All right, so this podcast is called Meat and Potatoes, and the meat and potatoes for you guys. What do you do to stay sane? If you know, it's exercise or anything cool or weird that you do to liberate your mind. How do you kind of structure your days? And then what you know, 1 or 2 software tools that you use that are kind of a lifesaver? Josh first, and then Stephen.
Awesome. So Monday, Wednesday, Friday, every day I wake up at 5:30. Tuesday, Thursday, it's realistically 6:30 because Monday, Wednesday, Friday, I go to the gym at 6. So that's a huge thing for me, and a huge part of my life is going to the gym, being physically active, because it just gives me more energy throughout the day to do whatever. I definitely notice on that Tuesday, Thursday that I might be lagging a little bit sometimes. And the last couple of weeks, I've been putting things in place to be able to get a good workout in the morning. So that's one thing that's important for me. And then the other thing that's important for me is in the evening, being able to hang out with my 2 little boys. They always ask me to wrestle, so wrestling them right after bath time, and then, you know, put them down to bed, and then hang out with the wife for a little bit as well. Sorry, what was the other part of the question?
Yeah, and then throughout your day, what kind of tools do you use, whether it's, you know, software or old-fashioned Post-it notes that keep you organized, like kind of your life-saving?
Awesome. Yeah. So the where is it? It's right here in my backpack. Old-fashioned. Write it down, right? I got to turn the page where I've got a bunch of stuff written down. But that's the thing that keeps me. I love computers. I love, you know, the technology and everything. But me being able to look on like an actual piece of paper helps out a ton. And then as far as my job, the one of the big, you know, lifesavers is the CRM that we use. We use HubSpot. We've come to like that one pretty good. And then my day, I like to get it kicked off anywhere between 8 to 9 o'clock working, and then pretty much just as much sales volume as possible until people stop picking up the phones around 5, 6 o'clock.
Yeah.
I wish they would pick up the phones until 9 o'clock.
Just call them at home.
But people have lives. It's crazy.
Follow them to their cars.
Yeah.
People love that.
Yeah. All right, Steven, your turn.
I may be less regimented than Josh. I wake up super early and then just get to work and you know, do all sorts of random things in the day to try and keep me sane. I've got you know, those perfect push-up things. I got those at Walmart for $16. Best investment ever if you want to destroy your shoulders. And so, you know, Josh, I'm sure you've heard me out of breath in random calls, and you know, I'm just trying to get them in between all the insanity. And then you know, I'm always embarrassed about this. You know, you talk about stress relief, how you get through the day. You know, occasionally I'll play Super Smash Bros for like 10 minutes, 15 minutes. I know I'm a grown man. I have children, for goodness sake. And still it just happens. And then, I mean, as far as software that we use, I mean, I guess Slack is really helpful for keeping everyone on task. I mean, it's really interesting how those technologies come about, where people say Slack is the most amazing thing on the planet. And Slack is great, but it is instant messaging. It's like Zoom. Zoom came out of nowhere, and people were like, wow, hail Zoom, long live Zoom. We've had video calling for years.
Yeah. And
I always wonder, like, why do some of these things just capture the hearts and minds of so many people? It's interesting.
Yeah. Well, I think there's a fair amount of luck and timing in the world, and it's better to be lucky than good sometimes. But I do love Slack. That's my favorite go-to. But yeah, when we bring on a new intern or somebody and like, hey, let's just use Slack for a while. Like, I've never used it. It's just GChat basically, but a little bit better.
Slightly better, saves messages.
Yeah, so but it's great. And we use HubSpot too as well for our CRM. But okay, cool. Yeah, everybody goes around their meat and potatoes of their job a little bit differently, and it's always interesting to hear how people do it and how they keep going. All right, well, if anyone's interested in getting in contact with you, either for working with you or becoming a partner, vendor, anything, what would be the best way for them to get in contact with both you and Josh?
Well, you can email us. Mine is Steven. That's with the PH. PHTEPHEN. I'm just kidding. It's an S. At Fia.Care. Josh is J.Goodrich at Fia.Care. You can log onto our website and shoot us a message through there, or you can send an owl. We do accept owls, but only after dark.
Well, Josh should use those for sales then, it sounds like.
Yeah,
exactly. Been watching a lot of Harry Potter recently.
They seem expensive. We have to use pigeons here still because we haven't made it to the big leagues.
Well, once you're working out of your basement, Garrett, you can also.
Okay, sounds good. All right, Fia Care and Josh Goodrich and Steven Fabiano, thank you for your time.
Thank you, sir.
Awesome. Thank you, Garrett.